Good afternoon, everybody, and thank you for joining us. My name is Debbie Hayes, and I'm the Upstate New York Area Director for the Communication Workers of America. We're having this press conference today because yesterday we notified Catholic Health that the workers at Mercy Hospital of Buffalo intend to go on strike if we do not reach a contract settlement by October 1st, 2021 of this year, within the next 10 days. Federal law requires that we provide the employer with a 10-day notice because we are a healthcare facility. This was an extraordinarily difficult decision for us to make, but Catholic Health has really made it impossible at this point for our members to provide the patient care that they deserve. Our members overwhelmingly, and I mean overwhelmingly, that only a strike will force management to do what is necessary to provide the necessary resources to provide adequate patient care at Mercy Hospital of Buffalo. Striking at a healthcare facility is something that no one ever wants to do, but we are at a breaking point. A new survey, which is being released today, some of our members on this call will talk about it in more detail in just a little bit, describes how we got to this point. And it provides a new look at the nearly universal concern from workers about the impact that the understaffing crisis is having on patient care. For weeks and months, we have been pleading with Catholic Health to invest in their workers so that we have the resources and support to do the patient care, provide the care that our patients deserve. Instead, they have offered a contract that would only deepen the staffing nightmare and put more patients and community members at risk. Their proposal on wages will not bring salaries up to levels needed to attract the staff we needed. And we actually still have hundreds of members that are making below $15 an hour. Their proposals on improving staffing are a rehash of just failed policies from the past. And they are proposing devastating increases in the out-of-cost premiums for a number of our healthcare benefits. So the vast majority of our workers, elected officials, and community members agree that Catholic Health needs to prioritize patient care, the safety and well-being of their employees. And it's time that they listen to us and that we negotiate an agreement that is in the best interest of our patients and the community that we serve. And what I'd like to do right now is hand this off to Jackie Atipio, who is an RN in the MIU at Mercy Hospital of Buffalo, and also president of CWA Local 1133. Jackie?
Jackie, you need to unmute.
Sorry. Thanks, Deb, and thank you to everybody who came. Thank you for spreading the word, because this really is a very serious situation we're in. And it's not just our employees, but it's truly all of the community that is affected. My name is Jackie Atipio. I'm a registered nurse. I'm the president of CWA 1133. I've been a nurse for 30 years. Our local union represents approximately 2,500 employees. That includes RNs, technologists, clerical service, right through the whole hospital. We pretty much cover. And they've been really working through some crises over severe staffing and limited resources. And I did write down some of the limited resources so that you'd really get an idea of just how severe and how pathetic this really is. We're short on urinals, sheets, blankets, washcloths, thermometers, urine tubes, blood tubes, syringes, and that's just a few. We could go on and on. There were pages of pages when we did the survey of showing what we're short on. It's just ridiculous. But despite all this, our staff still sacrifices their mental and their physical health, and they come in daily, and and they do what they can to help the people, but they're literally getting beaten down, and we're pretty much to the point where we just can't continue like this. CHS refuses to give us a fair contract. The negotiations are almost as if they can't hear what we're saying. This has been going on for years, even prior to COVID. This has been going on. And with our survey and with the patient care and with the level of the employees, just having it and getting a 97% vote to strike, sadly, something we'd never want to do, but sometimes you have to hit rock bottom before you can climb out. That's where we are right now. So I'll pass back to Deb, and thank you very much again to everybody for coming.
Thanks, Jackie. Our next speaker is going to be Corey Gambini, and Corey is the president of CWA Local 1168. Corey's also an RN, and she's the 1168 is the representative for the employees at St. Joseph Hospital.
Thanks, Deb. Thank you, everybody. Today's worker survey shows the devastating impacts of our staffing crisis. 70% of respondents say that they have seen patients be neglected or suffer needlessly because of the staffing shortages we are experiencing. Only 10% say patients are receiving quality, safe care that they need. 98% say their hospital is struggling to retain staff. Over 90% say that Catholic Health has failed to take adequate measures to solve understaffing. Over 70% reported that their hospital lacked the equipment and the supplies that they need to adequately perform their roles. This is a result of Catholic Health's clear failure to invest in its workers and prioritize their patients. Yet while they have taken steps to fill staffing needs, CEO Mark Sullivan makes $1 million salary, and the top 11 administrators make $7 million combined, and that's back in 2019. There's no excuses for the hospital system that allows executives to pull in millions in compensation while making it impossible, absolutely impossible, for frontline staff to provide the care our patients deserve and need. No one wants to walk off the job. As Deb said, this was a very difficult decision, but we need to stand up for our community. If Catholic Health won't put patient care first, then we are forced and must take action. Thank you. Thanks, Deb.
Thank you, Corey. And what I'd like to do now is turn the press conference over to Tim Kennedy, who is the New York State Senator from the 63rd District, and a man who, as always, has our deep respect for the work that he does on behalf of our members and his constituents.
Yeah, thank you very much, Deb Hayes and Corey Gambini and Jackie for those very important words. And I want to thank the media for being here to get this message out today. We want to avoid a shutdown over at Mercy Hospital. We want to avoid a strike, but we need to make sure that those workers that are the lifeblood of Mercy Hospital, that are taking care of the patients, have the resources necessary to do their job. So we're standing with the workforce. We're calling on Catholic Health to resolve this matter at the bargaining table to avoid a strike at all costs and to make sure that the nurses are paid a fair wage for a fair day's work, and that the patients have the resources through the workforce to be treated, accommodated, and taken care of appropriately. This, at the end of the day, comes down to, in its simplest form, a institution in Buffalo, New York, in South Buffalo, the heartbeat of the community, Mercy Hospital, taking care of those that take care of us when we are in our most vulnerable stages and when we are in a position where we need help and we need healthcare. The Mercy Hospital has stood as an anchor of the South Buffalo community, the Buffalo and Western New York community for generations. I have family members that work there today. I have family members that have worked there going back to my grandmother, my aunts, my uncles, my mother, who is a nurse. And so it is not only a neighborhood institution, but it is a Western New York healthcare institution. It is a beacon of hope for so many in our community. And oftentimes it is the place of first resort during an emergency or when someone needs healthcare. We turn to Mercy Hospital. We have to make sure that those angels that are taking care of us when we are in need are taken care of now in their time of need. We have to make sure that those healthcare professionals, the nurses and the healthcare professionals that work every single day to take care of us are compensated appropriately and aren't needlessly turned away when they are asking for assistance and asking for more resources to do their job and to do their job effectively. Everyone on this call will tell you, as healthcare professionals, once a nurse, once a doctor, once a CNA, once an LPN, once a dietitian or a therapist like myself, you are always thinking about other people. You're always putting other people ahead of yourself. And our job as healthcare professionals is helping other people. And oftentimes it's that selfless work that oftentimes rules the day, where those same healthcare professionals put themselves last. And now it's time for our community to rise up and make sure that those healthcare professionals know that we have their back in their time of need. So we are going to stand with CWA. We're going to stand with the healthcare workers and make sure that they know that our community stands with them and stands with the patients in these healthcare workers' time of need. And hopefully we can avoid this strike, but we need to make sure that the bargaining is happening in good faith and that the resources are given to the workforce that sacrifice every day to help our community.
Thanks so much for those words of support, Tim. Our next speaker is going to be Tina Knopp. Tina is an RN at Mercy Hospital who works in the ICU. Tina?
Hi, everybody. I'm going to try to do this without getting too emotional, and I did have to write a lot of this out just to keep my thoughts together. But I'm going to start with, my name is Tina. I've been a nurse for almost 10 years. The majority of my career has been spent in the critical care unit at South Buffalo Mercy Hospital, the intensive care unit that serves this community. Throughout my career, I have been the rock to many families. I have been the rock for families and patients that have gone through their most difficult times, patients that we've lost, loved ones that were lost. I have been that person for those families and those patients. I've seen miracles and I've experienced more sadness in my career than one person should. I'm going to try not to get too emotional. At one time, I was very proud to say where I worked. I was a proud nurse for South Buffalo Mercy, and I can no longer use those words. The past months have really made me rethink my career path. While a crisis is happening in our own community, A much larger crisis is happening in the walls of South Buffalo Mercy and the CHS facilities. Nurses and aides are burned out. We are tired and we need help. We are asking for help, and we have been asking Catholic Health for help for a long time. Despite our cries and pleading, we continue to work grossly understaffed and frequently experience supply issues. Whether it's something as simple as an alcohol swab or something as extreme as a life-saving medication, we continue to put forth our best efforts to serve our community to the best of our abilities. How does our staffing crisis affect you specifically in the community? I'm going to give you a few examples. In a critical care unit, nurses and aides care for every basic human need, from brushing your hair and your teeth to cleaning your waste. We're responsible for administering life-saving medications, treatments, as well as comforting those patients that survive and those during end of life. Typically, in a critical care unit, as a nurse, your staffing ratio should be 1 nurse to 1 patient or 1 nurse to 2 patients. It should be acuity-based, how life-threatening their illness is. During the past 18 months, I have seen countless times where the nurses are in a 1 to 3 patient ratio. That means 1 nurse for every 3 patients. During the COVID pandemic, I have seen 1 critical care nurse to 4 and 1 critical care nurse to 5 with a helper. This is so unsafe. In the event of an emergency, these nurses cannot attend to the patient's needs. You have to decide what can be done first, what is the most important priority in your daily tasks. During the last year, I have personally witnessed these shortages. Patients have been left for unreasonable lengths of time in their own waste, in their own urine and feces, asking for help, but you don't have somebody to help you clean them. It has taken a mental toll to the point that nurses are leaving the bedside in droves. Patients have removed their own life-saving equipment, ventilators used to support their breathing. They're pulling the tubes themselves in their own confusion, and you cannot tend to them in a timely manner. Patients are getting bed sores, and patients are falling, especially in isolation areas. You cannot get into those units. You need to mask and put on your PPE, and you cannot get to these patients in time, and they're being harmed. All of these instances are 100% avoidable, 100% avoidable. If you have nurses and aides and medical assistants available to save these patients. There is not a shortage of nurses. I want to be clear with that. There is a shortage of nurses that are willing to work under these conditions and under these unsafe ratios. There are nurses that have left in droves. The ICU at Mercy Hospital, in the past 6 weeks, we have put in 6 nurses have put in their notice, myself included. I can no longer do it. I cannot work under these conditions. We have a passion for what we do, but what price does Catholic Health put on our patients' lives? What price is your loved one? What is your mother worth? Because mine is worth much more. Thank you, Deb.
Thank you, Tina. If anybody has any question as to why we're doing what we're doing right now, then just stop and think about Tina's words and what our members are going through every day when they go to work. Our next speaker is a longtime friend of ours from Citizen Action, Jim Anderson.
Thank you, Deb, and thank you. Everything that has been said points to this stressful, alarming moment of time. And as Jackie alluded to, it even started before this COVID moment. There's community-wide concern, and it's over the shameful actions of the management, and it's turning its backs on our heroic essential workers who have risked their own lives, their own health to save us, the lives of our friends, our families, and our neighbors during this pandemic, and yes, even before it. it's clear, abundantly clear, that the arrogantness and unfairness of the meager proposal put forward by the Catholic Health will only deepen the staffing crisis at our hospitals and raise the alarm and concern in our communities. It is time for them to stand with the workers and with patients, and to know we in the communities across Western New York stand with the nurses and the healthcare workers, and we say, do the right thing. Catholic Health. Thank you, Deb.
Thank you, Jim, very much for those words of support. Our next speaker is Cheryl Darling. Cheryl is an ITA in the CVICU at Mercy Hospital of Buffalo.
Hi, thank you for having me. Like Debbie said, I'm an ITA in the CVICU. I've worn many hats at Mercy in the last 32 years, but my passion is really caring for patients. I am a 32-year employee with 12 years left to go until I hopefully retire. I've planned my life that I'd be retiring from Mercy, but as of late, I'm questioning if that's going to happen. I am constantly being floated to other departments, leaving my department short. And once I get to those floated departments, we're still short. I'll give you an example of most recent. I was floated up to the intensive care unit, where at the start of my day, I started with 8 critical patients. By 3 o'clock, one of our aides was pulled to a private one-to-one patient, leaving me with 18 critical patients at 3 o'clock. Thankfully, in the ICU, there's amazing staff up there, and everyone really teamworks it as best they can, and as short as they are on the floor, it really helped me, but it's scary when you've got 18 patients and you don't know which one you can get to first. As Tina said, they're critical. They're not people, they need you. They rely on you 110%. Another time I want to talk about where I was floated off of my unit was on a floor where it housed COVID and non-COVIDs at the same time. My assignment was 4 COVID patients and 4 non-COVIDs. Outside the COVID rooms was 1 isolation cart, which housed clean and dirty PPE on the same cart. I was frantic. I was terrified. I think I was crying under my mask and trying not to let people see how stressed I was about it. I have a mother in a nursing home, and the last thing I wanted to do was be put in a dangerous place where I would go into that nursing home and get my mother sick. I looked at the other nurses and asked, how do you do this? You've got a COVID room that you're supposed to go into. You don't know what's clean, what's dirty you're putting on you to protect yourself. And then you leave that COVID room, take off your PPE in the hallway, and then go on to a non-COVID room and take care of that patient. I did that for 4 hours that night. And when I left, my son called me and I answered the phone in near tears. My children have never seen me so stressed about working somewhere where they just don't care anymore about keeping their employees or their patients safe. We don't want to strike. We want to take care of our patients. But at this point, we see no other option to protect our patients and ourselves. Catholic Health is not listening to us when we say that patient care and safety is being jeopardized. We cannot do our jobs properly right now, and we cannot provide the care that we should be providing. And that is why our members voted 97% to strike. I don't want to leave Mercy Hospital. I don't. That's my home. I've got a lot of friends that I've made there that I consider my family. But I can't work for an organization like this if they don't take care of us and our patients. Thank you, Debbie. Sending it back to you.
Thank you very much, Cheryl. It's really hard to maintain your composure when you're listening to the members that you work with and represent on a daily basis describe what they go through at work every day. Our last speaker, and then we'll open it up to questions, is Jamie Banks. And Jamie is a radiology technologist at Mercy Hospital of Buffalo. Hi, Jamie.
Hi everyone. Thank you for listening. Like Deb said, I'm a CT technologist. I've worked for Catholic Health for over 8 years. Some of the things that I've seen or felt, it is very hard to leave work when you're up on the floors and you feel very defeated. You see these nurses, they are very short-staffed, they're very overwhelmed, there's no aides to help support them. They're doing total care themselves, and it's with huge patient loads, and it's very unsafe. One of the experiences I've had personally that sticks with you when you leave this building is patients that are being fed or given their dinner or their trays, and they can't feed themselves, so they have to wait for someone else to come along, and it's just delaying care. I myself have seen where, from the imaging side of things, some of our imaging departments have had to actually close due to short staffing. We don't have enough people. So some of our offsites, they've closed. We've also even had it where job offers have been put out to people who have refused due to what Catholic Health is offering. It's just very, very discouraging. No one has a desire to strike. We're already on a 15-month extension. We want to be with our patients. We want to help people. This is why we got into this position and took these roles. I mean, I hope you can hear it from all of our voices. It's just the conditions are just getting disastrous. And from last year, you know, we all band together, and now we're just into burnout, and the conditions are getting unsafe for patients, unsafe for nurses, unsafe for techs, trying to move patients by themselves because, again, you're short staffed. Again, no one wants to strike, but I don't know what other option we have at this point, because executives are not listening to what we're saying. Thank you for listening. Thank you, Deb.
Thanks, Jamie. And thanks for clarifying your job title. I'm sorry about that. Jamie is a CT technologist at Mercy.
Oh, that's okay.